Hi there, it's Dr. Starks again. I just wanted to continue to recognize Thyroid Awareness Month and talk to you about what you do when you find that you have a lump in your thyroid. So when you find a lump in your thyroid, these are thought to be something called a thyroid nodule, and these need evaluation. They need evaluation for a couple reasons primarily. The first of which is hyperthyroidism, so an overactive thyroid gland can be treated frequently with medical treatment, sometimes requires surgical treatment. And then the second reason, and the more concerning reason that we all look for these, is to find thyroid cancers that can be managed typically with a surgical treatment and sometimes with medical treatment to follow that. So how do we work this up? The first step in this is getting a blood test to look for something called TSH, stands for thyroid stimulating hormone. Sometimes your primary care doctor or the endocrinologist will want to get some additional thyroid tests, and those can all be done with a single blood draw. It's very straightforward. The second part of this is something called an FNA, or a fine needle aspiration. Fine needle aspiration sounds kind of scary. It's putting a needle into that nodule in the neck to draw a few of the cells out of it so the pathologist can look at it under a microscope. Although it sounds kind of ominous, it's actually pretty straightforward. It's a procedure that takes 5 or 10 minutes. We use local anesthesia so things are numb. And then we also use ultrasound guidance. And the ultrasound allows us to see the nodule underneath the skin, put the needle directly into it, and that greatly increases the accuracy of what we find, and it improves the results of what we find. So that's how we start out looking for thyroid nodules.